Hi, my name is Dr. Anthony LaVacca, and what I wanted to show you today is how the Trios has actually changed the way I practice. Today we're going to be placing an implant in tooth number 19. At that point in time, we're going to use the cookie cutter approach, which is a punch technique, which is not going to distort any of the soft tissue. We are then going to place a scan body, scan it with the Trios, so her next visit, when she comes in after her follow-up, will be delivery of the crown, which will save us and our patients time in the dental chair. So what I want to do is have you come on down here to our operatory, and what we're going to do is bring you into the surgical operatory and demonstrate to you how to get this done. Come on in. One of the things that has changed the way I practice implant dentistry is that we're able to scan the tooth on the day of surgery when we do the punch technique. Utilizing the Trios, we place our patient in and get her ready to go. We then mark the tooth number and the type of material we're going to use, along with the abutment. A lot of that information is added into this section here. And then what we're going to do is a pre-prep scan, place the scan body in the implant, place number 19, and then from there scan the scan body, which will allow for us to develop and build a crown for her next visit. Okay, so what I like to utilize is this prefabricated guide. This allows for me to place it in the patient's mouth and gives me a dead center position between the two adjacent teeth where the implant is going to go. And what we do is we place the fork in between the two teeth, and we begin to drill our 2mm pilot drill. Beautiful. Okay. And now what we're going to do is take a confirmation x-ray. I take my confirmation x-ray only with the implant down about 30% of the full length. And relax, and go. Good. Good, so my x-ray is demonstrated it's going straight down that mesial root. So what I'm going to want to do is hold on to it and grab into the interseptal bone. Okay, so now what we're going to do is remove our tissue. Like I said, with a cookie cutter approach, I've customized and designed my kit so that I have all the instruments in one place versus multiple kits. It makes my life a lot easier to have everything where I need it when I need it. Okay, 15, yellow. Let me get one x-ray. 3.8 by 15, perfect, yep. And ready to go. Chin up a little bit, good.
Ready?
And go. Beautiful. I love hearing that noise in the middle of the procedure. That tells me that I'm at my torque. Can I have a 2x2 and a pros kit? It'll be 3mm in height. What I'm doing is now ratcheting the implant into place. We're up at about 45 Newton centimeters, which is awesome in my book. And loosen it up a little bit and then tighten it back down to get the implant to about 2mm below the CEJ. X-ray ready?
Yep.
Hold on one second. Okay, what we're going to do is confirm our position with an x-ray.
Ready?
Go. Beautiful. Okay, and I'll take a 2mm healing abutment. Or 3mm, we're just going to take that for the pre-op impression. One of these things that's critical at this point in time is to adjust the adjacent teeth where the crown is going to go. Due to the fact that the size of the implant is not the same size as the tooth, you're putting a cylindrical implant in with a rhomboid tooth, and the contact area tends to be in the incisal third or the occlusal 1/3, which a lot of laboratories will then build in a natural food trap. So what I do is I put guide planes on the distal of the premolar and on the guide plane on the mesial of the molar, and that allow for my contours to come out of the implant across the tissue and then straight down, which will prevent any black triangles and food getting stuck in between them, which is very uncomfortable for the patient. So that's what I'm going to do now. Implant's in, implant's done. Not bad, right? Good. So now what I'm going to do is turn the rest of the show over to my assistants. They're going to do the pre-prep scan, take the healing abutment out, place the scan body. Once the scan body is placed, they will then scan the scan body and have a shade for the tooth and get the bite, so that the next visit in 4 months, she will have the tooth ready to go to be inserted for her enjoyment. Thanks for watching.
Yeah.
See, it's down already. So we got a lot of stuff out of there. Warm compresses will help get the swelling down. Tonight we're going to give you some antibiotics, some stronger antibiotics. We'll give you some pain medication. Try to sleep with a couple pillows up tonight.
Okay.
If you lay down, sometimes it drains and fills up a little bit more. You may have a couple black and blues up here. That's completely normal. The drains in there is going to be in there for 2 days. Oh wait, today's Thursday?
Yep.
Are you here Saturday?
I'm here Saturday.
All right, but you'll see Doc Saturday. We'll snip it out. It'll all start to heal, and then we're going to keep you on the antibiotics. Now that the infection's cleared up and gone away, we'll get you into either get that tooth out and do a bone graft right away, or I'll get that tooth out and put an implant in at the same time.
How long do you want?
Anytime next week if I can get them in.
Okay.
So, antibiotic, pain medication, you're good.
And then,
Drain.
how long do you want?
And leave it alone. Don't go sticking your tongue up there. Just leave it alone. All right.
Thanks, Doc.
Alright.
And welcome to the practice.
Thank you.
Sorry about that. Take care, right? I'm Dr. LaVacca.
Hey, Doc.
Hi. Yes.
Confused by what you need.
I need everything hardwired in
Everything is hardwired.
Okay,
so
then-
what is not hardwired?
I don't know. It's not working. Something's not working. Ben said. Ben, what was
I
not
know what
working?
is not working. It's not a I understand what
All right. Yeah. See what he needs, and then I'll be there. Hey guys, hi.
Hey, there's your buddy.
How's it going?
Good.
You doing good? What's going on?
Not much.
Not much. What happened? Somebody trying to have a fist fight with you at the house? No.
Do you like fist fighting? No.
Good. That's a good thing. Neither do I. I gave that up a long time ago. I moved down to New Jersey.
Old for that.
I am too old for that.
We hope we're all getting too old for that.
So what we have here, this is our pre-op impression, our pre-op scan. And what Becca's going to do, left side to get the interproximal area there. Looking good. She's now removing some artifacts from the scan. A pair of gloves. One of the things that's most important is that the scan bodies that we utilize for the system, you have the appropriate scan body for your laboratory. We've spent thousands of dollars on scan bodies and used different laboratories, and we find out that the laboratories don't use that scan body or they don't have the program for it. So the scan body, we like, since there's no real label on the scan body, we always verify and double check that our scan bodies are actually confirmed with the implant that's placed, and then we will remove it from the analog, and then from here we'll go intraorally to get the tooth scanned. Come on.
Want to take an X-ray?
No, I'm pretty good. I'll tell you 1 second. How's that feel? Can I have the shorter 5 extra?
Yeah,
Okay, we're down. We're good.
you're good.
There we go. Our scan is done. And open. And bite. That's it. Bite is done. So what you just did is your second visit coming back. So now you're just going to come, hello, how are you? And then 4 months you get a tooth.
Excellent.
A2, and what else? Okay, so now what Becca's going to do is we have our scans, we have our bite, we have our shade. It's going to go to our implant, dental implant laboratory, which is on our facility. We're going to use the roll and mill to mill this out of zirconia and put a tie base on it and do a screw retain restoration. Once again, she's going to come back for a 2-week follow-up to evaluate and see what's going on, make sure everything's okay. And then in 4 months, we will have our tooth ready for her to be inserted. Thank you for watching.